collagen and von Willebrand factor is exposed, and via GP1B and factor 9 and receptor, and GP2B and 3A receptor, a primary hemostatic plug is created. So platelet activation, conformational change, platelet adhesion, and platelet aggregation. Then a definitive clot is formed due to clotting factors. Clot formation requires platelets, clotting factors, and vascular endothelium. Clotting factors are 1, 2, 3, 4, 5, 6, 7, 9. There is no 6, but 7, 8, 9, 10, 11, 12, and 13. First is fibrinogen. F for first, F for fibrinogen. Second is prothrombin. Third is T for third, T for tissue thromboplastin. 4 is calcium. 5 is proacceleratin. 7 is proconvertin. 8 is anti-hemophilic factor A. 9 is anti-hemophilic factor B, which is also called Christmas factor. 10 is Stewart-Brower factor. Stewart Little is in standard 10. 11 is anti-hemophilic factor C. 12 is Hageman factor. 12 Hageman. And 13 is fibrin stabilizing factor, the last one. Coagulation cascade, positive feedback mechanism, intrinsic pathway, that is contact activation in labs, negatively charged surface molecule, factor 12 to 12A, 11 to 11A, 9 to 9A with the help of calcium, which is factor 4, thrombin 8 to 8A with calcium, and while in the extrinsic pathway, that is tissue injury, tissue factor 3, that is tissue thromboplastin is converted to 3A and it combines with 7A, which is also converted from 7, like 7 activated, that is proconvertin. So tissue thromboplastin activated with proconvertin activated goes into the common pathway. From here, you are having 8A, and from here, in extrinsic pathway, you are having 7A. They go and they convert factor 10, that is Stewart powered factor, to activated 10. Common pathway is also thrombin, that is which is converting proacceleratin to activated and converting with the help of calcium along with activated 10 prothrombin to thrombin. Prothrombin is factor 2. It is converted to factor to A, which is converting fibrin to activated fibrin. Also factor 13, that is fibrin stabilizing factor, because of thrombin is converted to activated 13, and the fibrin along with calcium and fibrin stabilizing factor forms a stable fibrin clot. Applied aspect. Clotting factors. Fibrinogen and deficiency will cause the disease afibrinogenemia. Prothrombin will cause hypoprothrombinemia, secondary to vitamin K deficiency. Proacceleratin, parahemophilia. Proconvertin, hypoconvertinemia. Antihemophilic factor A, hemophilia. Antihemophilic factor B, Christmas disease. Antihemophilic factor C, plasma thromboplastin. Antecedent, PTA deficiency. Hagman factor, Hagman triad. Coagulation profile: activated partial thromboplastin time APTT versus prothrombin time PT. Substances used APTT, kaolin. Coagulation profile. So substances used in activated partial thromboplastin time APTT, kaolin, which converts factor 12 into 12A. Factor 12 is Hagman factor, activated 12, activated Hagman. Then syphilin, substitute for platelet phospholipids and calcium. Those are the substances used in APTT, activated partial thromboplastin time, and prothrombin time is PT. You use exogenous tissue, thromboplastin, and calcium. Pathway assessed by APTT, intrinsic and common pathway. In PT, extrinsic and common pathway. Normal range of APTT is 26 to 40 seconds, and PT is 11 to 16 seconds. So extrinsic and common pathway is shorter, 11 to 16 seconds, which is roughly half than APTT. So prothrombin time is roughly half than APTT. Prothrombin time is 11 to 16 seconds. What does the defect deficiency of factors? In APTT, it will be factor 8, 9, 11, 12, 5, and 10, fibrinogen and prothrombin. And in PT, you can detect factor 7, factor 5, factor 10, fibrinogen, and prothrombin. So fibrinogen and prothrombin is in both, and 5 and 10 is also in both. The difference in PT is factor 7, which is proconvertin. You can see it in here in the extrinsic pathway, factor 7. Coagulation profile. Platelet count is 1.5 to 4 lakhs per millimeter cube. Bleeding time is 2 to 8 minutes. Clotting time is 3 to 6 minutes. Anticoagulation pathway. Mechanism. Thrombin plus thrombomodulin activates protein C, protein S, and tissue plasminogen activator. So tissue plasminogen activator will activate plasminogen to plasmin and fibrinolysin. Thrombin plus thrombomodulin will also activate protein C, protein S, which will inactivates factor 5 and factor 8, and tissue factor pathway inhibitor. Antithrombin 3 plus heparin inactivates factor 9, 10, 11, and 12. Anticoagulation pathways, starting with thrombin and thrombomodulin. Factors regulating anticoagulation pathways. Plasminogen activator inhibitor, alpha 2 antiplasmin, thrombin activable fibrinolysis inhibitor. Note, role of vitamin K in coagulation is that warfarin inhibits the formation of glutamic acid to gamma carboxyglutamic acid.